Only 30% of hearing care professionals do this, which makes this the best kept secret in audiology. Hey guys, welcome back to the DrCliffAuD vlog. This is vlog number 290, and today I want to talk to you about a certain procedure that is used to guarantee that you receive the maximum amount of benefit from your hearing aids. But before I get into today's video, guys, do me a huge favor, click the like button. It really helps out the channel. And if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well. It's greatly appreciated. So back when I was in grad school, we're talking around 2012 at this point, I was taught about a certain procedure that is used to make sure that hearing aids are programmed correctly to a patient's hearing loss prescription. We call this real ear measurement. It's basically a way that we can place probe microphone tubes inside of your ear canals and actually measure how much amplification you're receiving in relation to your hearing loss prescriptive targets. Now, when I was taught about this in grad school, they drilled it into our brains that it is absolutely critical that we perform this verification measure on every pair of hearing aids that we fit and program. And the reason why they beat this into our heads is because research has consistently shown that real ear measurement can result in a significant performance improvement, not just in quiet situations, but background noise situations for our patients. I got so into real ear measurement when I was in grad school that I refused to apply to any externship locations that did not have real ear measurement equipment. Right off the bat, this eliminated around 70% of all the externship locations that I was considering. Now, you might be thinking to yourself, Cliff, is real ear measurement really that critical to maximize your performance with hearing aids? Well, let me explain it this way. So, in a recent research article, they basically identified that 80% of individuals had preference for the programming of their hearing aids when real ear measurement was used. But this does mean that 20% of people did prefer amplification settings that was not verified with real ear measurement. We essentially call this the first fit settings. It's the auto programming that's done inside of a hearing aid manufacturer's software after you enter your audiogram into it. But here's the kicker. Almost every single individual, we're talking nearly 100% of the participants, actually performed better when real ear measurement was used to program their hearing aids. So even if you don't have preference for the way that things sound with your hearing aids, you actually perform significantly better. Now, when I finally went to my externship site, literally on the first day, someone had come in from a different clinic basically complaining that their brand new hearing aids were not providing them with a significant amount of benefit. So the clinician at the original clinic that they purchased their hearing aids from was basically like, well, let me give you a free accessory to make up for it. Now, free accessory or no free accessory, this person still could not hear with their $5,000 pair of hearing aids. So they brought it into our clinic, and it wasn't even me doing this, but one of the students that was at my externship location performed real ear measurement on this individual's devices, reprogrammed his hearing aids to match his prescriptive targets, and voila, this person could hear again. So here's the thing, real ear measurement almost always results in a significant improvement in performance when wearing hearing aids. So if this is the case, then why do so few hearing care professionals actually use real ear measurement? Well, this is one of the things that I'm going to be covering in my free live webinar that I'm giving on October 23rd at 2 p.m. Mountain Standard Time. I'm titling this webinar, The Best Kept Secret in Audiology. So if you want to learn exactly why real ear measurement is so critical, and you want to actually see case studies of patients who have gone from not being able to hear well with their hearing aids because they never had real ear measurement performed, to us completely turning around their performance with real ear measurement, you will not want to miss this free live webinar. Again, I am doing this webinar live on October 23rd at 2 p.m. Mountain Standard Time. I will have a link in the description of this video, and while you're at it, leave me a comment in the comment section and tell me if you want to attend.